in a community. Hi everyone, by the way, this is Elena and welcome to my channel. This is my first ever video and I just want to give you a brief information about myself. I am currently working as a pharmacist in a community pharmacy setting here in the Philippines, and I am just doing this video to help educate myself and be reminded about all the things that I should know as a pharmacist, because I believe that the more you share the information that you know to other people, the higher the probability that it stays here in your mind. Okay, so just a disclaimer guys, this is not a medical advice. Okay, this is not a medical advice and you should still consult your doctor, and you have to stick to what your doctor has prescribed you. The frequency and the drug dosages will always be dependent on your case as a patient, and usually doctors depends it according to your age, according to your weight, according to the severity of your disease as a patient, and many more. Okay, so for today, I'm so excited because we are going to talk about ciprofloxacin. So let's get started. Ciprofloxacin is an antibiotic that belongs to the second generation fluoroquinolones. And usually doctors prescribe ciprofloxacin for many systemic infections such as cystic fibrosis, lower respiratory tract infections such as pneumonia. It can also be used as a second-line agent in the treatment of tuberculosis, especially if the first-line agents are no longer working to the patient, or is no longer working to the patient. And it can also be used for skin infections. It can also be used for complicated and uncomplicated cases of UTI and many more. Now proceeding to the dose, guys, again, the doctor is the one who will decide for that. But the usual adult dose, especially if it is in an oral dosage form like tablet and granules, it usually ranges from 500 to 750 milligrams twice a day with a duration of 7 to 14 days. So when we say twice a day, twice a day, it is recommended to take your medication every 12 hours. So there will be a 12-hour of interval. Example, 7 a.m. and 7 p.m. Okay? Now let's proceed to the basic information that you as a pharmacist should tell your patient, and you as a patient should know about your medication. So I have provided 6 reminders. Okay, so let's get started. First reminder, if you are being prescribed for ciprofloxacin, usually it is best taken on an empty stomach. Yes, it is best taken on an empty stomach. So you have to space out 30 minutes before food or 2 hours after food. Say for example, if you are usually eating your breakfast by 8 a.m., so you decide whether you wanted to take it 30 minutes prior to food or 2 hours after food. So basically, you can take it by 7:30 a.m. and p.m. or 10 a.m. and 10 p.m. Okay, that would be reminder number 1. Reminder number 2 is you have to avoid taking ciprofloxacin within 2 hours with antacids, okay, or anything that contains aluminum, magnesium, and calcium. And if you are also under iron supplements and also zinc, especially multivitamins, guys, because these usually contains these minerals. Why do we avoid this in taking ciprofloxacin within 2 hours of taking of this minerals? Why? Because it can decrease the absorption of ciprofloxacin. Now let me just clarify you guys, I didn't say that you have to stop taking those. I just said that you have to space 2 hours. Okay, 2 hours. Say for example, you took your ciprofloxacin by 8 a.m. So you can take it after 2 to 3 hours. Siguro, kapag tinik mo yung ciprofloxacin mo ng alas 8, pwede ka mag-take ng iron supplement mo or multivitamins mo ng alauna ng hapon, like that. Okay? So the third reminder is, if you are planning for an activity under the exposure of the sun, it is still recommended to minimize in doing that, or you might want to consider doing those activities with a sunscreen protection. Example, sunscreen lotion, umbrella, or you can also use long sleeves. Why? Because prior to taking ciprofloxacin, it can make your skin a little bit more sensitive than the usual. So it can promote photoallergic reaction, especially if you are exposed under the sun or sun lamps. Alright, so the fourth reminder would be ciprofloxacin can usually cause mental it can affect your mental alertness or coordination. It can have it has the possibility to cause you CNS disturbances. So if you are going to drive for a long kilometers, you might want to, you know, ipasa mo na lang sa sa kaibigan mo, siya na lang mo mag-drive. Or if you are working as a factory or machine operator, like that. So pwede kang mag-excuse na lang muna or mag-ingat ng sobra kapag nagsisiprofloxacin ka, kasi pwede kang maantok or pwede kang mahilo. Alright? And the fifth reminder, if you experience tendon pains, you can freely go back to your doctor and you have to report those cases. Okay? And last reminder, guys, you are required to complete your regimen and you should not stop taking it although your symptoms are already alleviated. So have to take note that just because the pain is not already there, it doesn't mean that you have to stop taking it. So if the doctor prescribed you 14 tablets for 7 days, you have to finish all of it in 7 days. Now let's proceed to the dispensing consideration. Okay, so first is ciprofloxacin is highly used with caution, especially to those patients with epilepsy or with history of seizures. Second consideration is the patient should also be reminded about the proper hydration, or you can tell your patient that they have to drink plenty of water of more than 2 liters per day while under the medication of ciprofloxacin in order to help reduce the risks of kidney damage and the promotion of urinary crystalluria. And the third and the last would be the use of ciprofloxacin is not recommended to patients who are pregnant or breastfeeding. So that's it for today, guys. I hope that you somehow learned a lot of things about ciprofloxacin. So the next time that your doctor will prescribe this to you, you have to do some of the tips or some of the reminder that I said a while ago. So that would be all for today. Any questions or you have some questions, you can comment down below and I'm gonna try my best to answer those questions to my next video for the next weeks. Okay, so that would be all. Thank you. Maybe